What is the primary goal of an infection prevention and control program? A. Reducing hospital costs. B. Preventing HAIs and protecting patients, staff, and visitors from infection. C. Meeting Joint Commission accreditation requirements. D. Tracking antimicrobial resistance patterns. The correct answer is preventing HAIs and protecting patients, staff, and visitors from infection. An infection prevention and control IPC program aims to reduce the risk of healthcare-associated infections through surveillance, education, policy implementation, and outbreak management, protecting patients, healthcare workers, and the public. What does the acronym HAI stand for? A. Hospital-acquired illness. B. Healthcare-associated infection. C. High-acuity intervention. D. Hygienic antiseptic indicator. The correct answer is healthcare-associated infection. HAI healthcare-associated infection replaced the older term nosocomial infection to reflect that these infections can occur in any healthcare setting, not only hospitals. HAIs include CLABSI, CAUDI, SSI, V, and C difficile infections. Which organism forms spores that are resistant to alcohol-based hand sanitizers? A. MRSA. B. Clostridioides difficile. C. Pseudomonas aeruginosa. D. Candida auris. The correct answer is Clostridioides difficile. C. difficile produces spores that are highly resistant to alcohol, soap, and water. Physical removal is required for hand hygiene after caring for C. diff patients or when hands are visibly soiled. What is the most important single action to prevent healthcare-associated infections? A. Wearing gloves for all patient contact. B. Using N95 respirators during all procedures. C. Performing hand hygiene at the correct moments. D. Isolating all patients with known infections. The correct answer is performing hand hygiene at the correct moments. Hand hygiene is the single most important infection prevention measure. The WHO 5 Moments framework defines when hand hygiene should be performed: before patient contact, before aseptic task, after body fluid exposure, after patient contact, and after touching the patient's surroundings. Which personal protective equipment is required when entering the room of a patient on airborne precautions? A. Surgical mask. B. N95 respirator or higher. C. Gloves and gown only. D. Face shield alone. The correct answer is N95 respirator or higher. Airborne precautions protect against pathogens spread via droplet nuclei 5M, TB, measles, varicella. HCWs must wear a fit-tested N95 respirator or PAPR before entering the room. What does the standardized infection ratio SIR measure? A. The total number of HAIs in a facility per year. B. The ratio of observed to predicted HAIs, adjusted for patient risk factors. C. The infection rate per 1,000 patient days. D. The percentage of patients who develop infections. The correct answer is the ratio of observed to predicted HAIs, adjusted for patient risk factors. SIR equals observed infections, predicted infections, and SIR of 1.0 equals national baseline. 1.0 equals worse than predicted. 1.0 equals better than predicted. It enables fair comparisons between facilities with different patient populations. Which category of transmission-based precautions requires gown and gloves upon entering the patient's room? A. Airborne precautions. B. Droplet precautions. C. Contact precautions. D. Standard precautions. The correct answer is contact precautions. Contact precautions are used for pathogens spread by direct or indirect contact. MRSA, VRE, C. diff, scabies. HCWs must don gown and gloves before entering the patient's room or care area. What is the first step in a healthcare outbreak investigation? A. Implement enhanced precautions immediately. B. Verify the diagnosis and confirm the existence of an outbreak. C. Notify public health authorities. D. Culture all patients in the affected unit. The correct answer is verify the diagnosis and confirm the existence of an outbreak. The first two steps are verifying the diagnosis, are these real cases, and confirming an outbreak, is the case count above expected baseline. Acting on unverified data wastes resources and can cause unnecessary alarm. Hepatitis B transmission risk from a single needle stick from a known HB positive source is approximately A. 0.3, B. 1.8, C. 630, D. 60. The correct answer is 630. HBV is the most efficiently transmitted bloodborne pathogen via needle stick. 630 if source is HB ag positive, highly infectious. By comparison, HCV 1.8, HIV 0.3, HBV vaccination is the best prevention strategy. What level of reprocessing does a critical medical device, one that enters sterile tissue, require? A. Low-level disinfection. B. High-level disinfection. C. Sterilization. D. Intermediate-level disinfection. The correct answer is sterilization. Spalding classification. Critical items: contact sterile tissue or vascular system sterilization. Semi-critical mucous membranes, high-level disinfection. Non-critical intact skin, low-level disinfection. Which disinfectant is effective against C. difficile spores in the environment? A. Quaternary ammonium compounds. B. Isopropyl alcohol. C. Sodium hypochlorite bleach. D. Hydrogen peroxide 3. The correct answer is sodium hypochlorite bleach. C. difficile spores are resistant to most common hospital disinfectants, including quats and alcohol. Sodium hypochlorite 1.5 ppm and registered sporicidal agents are effective for environmental decontamination. An epidemic curve shows multiple peaks separated by the incubation period of the causative organism. What type of outbreak does this suggest? A. Point source outbreak. B. Propagated person-to-person outbreak. C. Continuous common source outbreak. D. Environmental source outbreak. The correct answer is propagated person-to-person outbreak. A propagated progressive source outbreak produces successive peaks on the epidemic curve, each separated by approximately one incubation period representing generations of cases spreading person to person. A point source outbreak produces a single sharp peak. What is andragogy? A. The study of childhood infectious diseases. B. Adult learning theory based on self-direction, prior experience, and intrinsic motivation. C. A Greek term for hospital infection control. D. A method of antibiotic stewardship. The correct answer is adult learning theory based on self-direction, prior experience, and intrinsic motivation. Andragogy Malcolm Knowles describes adult learners as self-directed, motivated by internal factors, experience-based, and needing to understand the relevance of learning. It is the foundational framework for designing HCW infection control education programs. What is the recommended action for hand hygiene when caring for a patient with norovirus gastroenteritis? A. Alcohol-based hand rub faster and equally effective. B. Soap and water. Alcohol does not reliably inactivate norovirus. C. Chlorhexidine-based hand scrub only. D. No special precautions beyond standard glove use. The correct answer is soap and water. Alcohol does not reliably inactivate norovirus. Norovirus has limited susceptibility to alcohol. Soap and water physically removes the virus from hands. This recommendation also applies to C. difficile care. Use of appropriate contact precautions and environmental bleach cleaning are also essential. Which of the following is a nationally notifiable disease in the United States? A. MRSA colonization. B. Influenza seasonal. C. Tuberculosis. D. C. difficile infection. The correct answer is tuberculosis. Tuberculosis is a nationally notifiable disease that must be reported to local state health authorities. Notifiable diseases are those with public health significance where reporting supports outbreak detection, surveillance, and control efforts. What does the CIC credential stand for? A. Certified Intensive Care Nurse. B. Certificate in Infection Control. C. Certified Infection Control. D. Certification in Infection Control. The correct answer is Certification in Infection Control. CIC stands for Certification in Infection Control, the professional credential granted by the Certification Board of Infection Control and Epidemiology CBIC. It validates competency across infection prevention and control domains. An ICP calculates a CLABSI SIR of 1.4 for the past quarter. What does this indicate? A. The facility had 40 fewer CLABSI than predicted. B. The facility had 40 more CLABSI than the national predicted baseline. C. The SIR is within acceptable limits and no action is needed. D. The surveillance data is inaccurate and should be resubmitted. The correct answer is the facility had 40 more CLABSI than the national predicted baseline. SIR equals observed predicted, and SIR of 1.4 means the facility observed 140 of the predicted infections, 40 more than expected based on the national baseline. This warrants investigation, root cause analysis, and targeted prevention efforts. What is the primary purpose of an infection control risk assessment (ICRA)? A. Evaluating hand hygiene compliance rates before a joint commission survey. B. Identifying and mitigating infection risks during construction, renovation, or maintenance in healthcare settings. C. Determining which patients require contact precautions on admission. D. Reviewing antibiotic prescribing patterns for stewardship compliance. The correct answer is identifying and mitigating infection risks during construction, renovation, or maintenance in healthcare settings. ICRA are required before construction or renovation projects in healthcare facilities. They identify risks, dustborne aspergillus, water system disruption causing Legionella, and specify controls, barriers, HVAC adjustments, traffic routes, and patient placement modifications. Which NHSN device-associated module tracks ventilator-associated events VAEs? A. Procedure-associated events PA module. B. Device-associated events DA module. C. Antimicrobial use and resistance AOR module. D. Long-term care facility LTCF module. The correct answer is Device-associated events DA module. The NHSN Device-associated events module tracks VAE ventilator, CLABSI central line, and CAUTI urinary catheter. The procedure-associated module tracks SSIs. Correct module selection is essential for accurate SIR calculation and CMS mandatory reporting. What is the recommended sequence for removing doffing PPE after leaving a patient contact room? A. Mask, gown, gloves, eye protection. B. Gloves, goggles, face shield, gown, mask, respirator. C. Gown, gloves, eye protection, mask. D. Eye protection, mask, gown, gloves. The correct answer is gloves, goggles, face shield, gown, mask, respirator. CDC doffing sequence removes most contaminated items first. Gloves most contaminated. On hands that touched patient. Eye protection, gown, mask, respirator least contaminated. Hand hygiene should be performed after glove removal and after all PPE is removed. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of practice questions with detailed explanations.